So welcome everybody. My name is Louise Younie, a GP and Professor of Medical Education. Megan?
Everyone, I'm Megan Tjasink. I'm a Principal Art Psychotherapist at Barts Health NHS Trust, and I'm also a final year PhD student with the Wilson Institute of Population Health at Queen Mary University of London.
Hi everyone, my name is Elle Tallgren. I'm a fourth year medical student at Barts and the London or Queen Mary University with a special interest since first year in creative inquiry and flourishing.
Brilliant. So just, oops. So each of us will give a short overview of flourishing, and then we're going to open. Hopefully, that will take about half an hour, and then we will open for questions. So I'm going to kick off. So just to start, in 2019, the BMA, GMC, and Health Education England all were concerned about and measured the issue with burnout amongst clinicians. Since then, we obviously had the COVID pandemic, and now the global burnout rate stands around 30 to 70%. So clinician well-being has been described as a wicked problem, and that is a problem that is difficult to define and also doesn't have easy solutions. And there's an image of the canary in the coal mine, and the idea that, you know, should we be tending to the canary whilst there isn't any good air for it to breathe? Perhaps we need to look at the air that the canary breathes down the mine. So one of our big approaches has been an individualistic approach, looking at the individual clinician and their resilience. And this is highlighted by the vast amount of research on physician resilience. But actually, there are a few issues with resilience, and for some people describing it's only part of the solution, maybe for those parts of your job that where there's unavoidable challenge like patient suffering, being alongside patient suffering. But there's a risk of resilience shaming. And one of the ways we talk about it, resilience in material science, is how much material can take until it snaps. And that's how resilient it is, which doesn't feel like a good metaphor for our inner lives. There's also a brief resilience scale here on the screen, and this is, you can show how strong you are and how able you are to bounce back from everything. But it doesn't really take into account the hard times that you may have gone through at different times in your life. It doesn't feel like a useful scale for taking into account the challenging spaces that we might inhabit. I'm not going to show this slide, but the slides will be available afterwards. This is a funny 2-minute sketch on resilience, which I'd encourage you to look at. Make you feel better, by Glaucomflecken. But just to kind of take in the context and the environment within which we're working, and the neoliberal drive that is kind of the invisible forces that are moving more and more towards competition, individualism, market economies, where the doctors are like or the healthcare professionals are like the automaton, the cogs in the machine. And it feels a bit like when they get tired or weary, they just get replaced by another one, as we see with the F3 brain drain out of the profession. So in that context, flourishing, just like to be realistic, flourishing in the context of our neoliberal working environments is challenging. But we're going to explore what flourishing might mean and how it might support us. So I often do word clouds with people. Didn't have time to do it in a 10-minute session, but these are the kinds of words that people use for flourishing. Growth is nearly always the biggest in the middle there. And then there's usually a selection of a few different ones. Elle, who's here with us, said the words, flourishing is a kinder way to grow. And exploring the field of flourishing, I have been sharing ideas with students, and then they bounce back ideas back to me to help me understand the field better. But it draws on the old concept of Aristotle's eudaimonia alongside the hedonia. So hedonia, eating chocolate, or I don't know, buying something to make you feel better. And the eudaimonia is around meaning and purpose. So it's an old concept, but it's also a new concept. There's been a lot of investment. So the Templeton World Charity Foundation have invested 60 million, or it might be 100 million now, into the field. The Kern National Network is a group of medical schools looking at flourishing in America, and Harvard has a human flourishing program where they're trying to measure flourishing. But the definition is still not really clear, and there are different perspectives. So flourishing as a noun would fit the Harvard approach of trying to measure individual flourishing. Personally, not so interested in that. We're more interested in flourishing as a verb, as a way of growing, as a direction of travel. Because I don't think you just flourish and then you've made it and that's it. But actually, life is difficult and complex, but perhaps there are ways in which we can grow that allow flourishing along as we go along our way. So the work started really with bringing creativity into medical education, first and foremost to enable person-centered care, and then I realized that as we humanize the students, that humanize the patients, we humanize the students. And I started exploring the idea of human flourishing rather than resilience as a way towards well-being. So here's some examples of creative inquiry work over the years with medical students. And a reminder of the importance of the human dimension. This is double-stranded DNA here, alongside the clinical dimension in our patient encounters and in medical education. So creative inquiry is perhaps one of the foundational ways in which we've been exploring flourishing, and that's through exploring our lived experience with any of the arts. You don't have to be talented, but it's about playful engagement, opening yourself to using other languages and expression of lived experience with other kind of media, whether it's poetry or dance or sculpture. And again, this is back to Elle, but you say it so well, Elle. I don't have to bounce back from every hard experience like I had permanent springs under my shoes. They're not permanent and they get rusty easily. The journey towards flourishing allows me to take painful experiences with me, explore them through creative inquiry, and accept them as part of me rather than flaws I'd like to exclude from my life. And so I've created a flourishing model based on the work with the students, and nearly all flourishing models have meaning making in them and they have connection, but none of them have the shadow work, which is a Jungian idea of engaging with stuff that's difficult in ourselves or in our lives. And actually, I think that that's probably one of the most important parts of flourishing. And so here, students might express imposter syndrome. The face is here on the floor. Or talk about perfectionism, for example. And we know that these two are two core drivers of mental health challenges for medical students. But by bringing it out into the open, it means that we can start to have conversation, we can normalize it, we can realize that people are not alone in having those sorts of feelings, because in fact they're very common. Or here, I love this picture with the guy smiling coming out of the emergency department, but actually underneath is wondering, I don't know enough, I feel lost, am I getting in everyone's way? And here I've got this is a student image from many years ago with a little black fish here that she said she felt like, and then all the other medical students with these brightly coloured fish. And a different student said, I didn't expect to hear that other students felt out of their depth, or like other people were more talented and bright than them. So it's nice to discover I'm not the only one. I didn't expect how open and honest everyone would be, and it was refreshing. So there's something about rehumanizing when we share some of the challenges and share some of the actual things that are going on for us. There's a sort of a rehumanizing and realizing that we are, that it's normal to feel a sense of struggle. So we've moved from resilience towards flourishing, but we're starting to explore flourishing spaces. So it's not so much, are you flourishing or not? But actually, what are the spaces that would enable flourishing in higher education or in healthcare or in a patient encounter? And we're exploring it in different ways. So here's just a few small ideas. One is that the flourishing space might be conceptualized by a space where we can be vulnerable, where we value our humanity and, that sense that we do fall short, but that's okay, and that we can find our own unique voice. Or another way is thinking about connection, so reconnecting with ourselves and with each other, with meaningful work and with the environment. We're just exploring some other ways into flourishing spaces. So rather than EDI, we've been exploring belonging, dignity, and justice from Decolonized Design, which is a Black-led organization, and how these align with flourishing. So the work is ongoing in that space. But also self-determination theory. And in fact, the guys who set up self-determination theory worked with a moral philosopher in this book chapter, looking at how the ideas of self-determination theory align with human flourishing. And I think there's probably more work to be done here in terms of healthcare professionals, and that finding ways, rather than sort of well-being, well-being courses and things like that, that actually in our workplaces we might be able to have more autonomy, belonging, and competence. May do a lot more for our well-being than small well-being courses. I think I'll finish with students' words. So the two students created a acrostic poem, one for resilience, so you can see it's written down the side, resilience, and the other on flourishing, because the students often say it so well. So for resilience, really push yourself to limits, excel in everything you do, stop letting hardships affect you, invest in yourself, leave nothing to chance, it's no big deal. Expect greatness, no matter the circumstances, everything, always. And for flourish, finding yourself, living with mistakes, opening yourself to new experiences, understanding it's okay to change, realizing growth is not linear, inviting forgiveness, staying true, holding space. So, and there's more. We have a flourishing website, which I'll put in the chat. I'm just going to stop now. Elle, can I invite you to come in and share some of your experiences and thoughts as a medical student?
Yeah, absolutely. Thank you, Louise. It feels such a privilege to get to hear your words, especially as a medical student. This work being done in medical education is really important. So just to kind of introduce myself again, I think there's some new people that have come in. So my name is Elle Tallgren. I'm a fourth year medical student at Barts in the London. And I've been exploring creative inquiry and flourishing since first year of medical school. So before I started medical school and even during the application process, I was in quite a bad state of burnout and really kind of going through the symptoms of that while trying to finish high school or A levels. And I was quite nervous when I started out kind of in the middle of the pandemic, when I kept hearing this word of resilience being kind of preached. And that was something that I was asked to reflect on also in my medical school interviews. And I really wasn't feeling very resilient coming into medical school from just about starting to heal from burnout and feeling like maybe I'll be able to study again and push myself academically. So I was quite terrified about this feeling of need to be resilient, where I felt like I had kind of nothing to push back from. But then midway through first year, we were asked to choose a student-selected component, so a little course where we could kind of have a choice in what we wanted to look at for 2 weeks. And Louise's course for creative inquiry in medicine popped up. And I was kind of choosing between photography and medicine when I was thinking about what to study in university. Quite different fields, I agree. But I chose medicine because I thought that I can still practice photography alongside it. Naturally, I stopped the second I started medical school, but it felt like Louise's course was something where I could maybe tap back into the kind of creative side of myself. But what I didn't really expect was that there was an answer kind of offered to me through this course that was an alternative to the kind of feeling of being afraid about needing to be resilient. So flourishing was kind of offered as an alternative to resilience. And that kind of thought never left my mind ever since I completed that course, that I can strive, but I can walk kindly towards flourishing rather than resilience. And maybe the outcomes actually for myself and my well-being will be better. And when my well-being is better, I believe that it will also lead to better care from myself as a medical student and hopefully also in the future as a professional. And something that was encouraged during this course was daily reflections. And that's when I started practicing this art of kind of writing down things daily, which was very different from my photography work. And it, in a strange way, also allowed me to look at myself in a bit more detail than how I looked at myself through my photography. And I slowly started to build this daily journaling habit. It's been almost 4 years since I did that course with Louise, but it's evolved into this habit that is now almost like vital to me to be able to recognize myself and what I'm going through in my daily life. And I have my journal from the past 6 months here next to me, just kind of as a testament to this practice. And I noticed that this is how I create a flourishing space for myself, almost on a daily manner. It started by kind of being nervous to even write my unfiltered thoughts, to then being comfortable with writing down those sentences and almost enjoying that ink flowing on the paper. And once I started to enjoy the process of writing, I started to see my thoughts. First being a bit nervous about what I was seeing and what I was so honestly putting on that paper, to then eventually starting to accept what my thoughts were, how I was feeling as I was kind of walking through medical school with other personal challenges going on in the background. And once I started accepting those thoughts and those feelings and what I was thinking about on a daily manner, I started to talk about them. And eventually now I'm at the point that I'm sharing my journal and I'm talking about it. And so it's kind of gone from a point of view of writing, seeing, accepting, and finally sharing. And that is my own personal way of kind of flourishing in medical school. And now I'm writing a dissertation on how flourishing spaces or flourishing through creative inquiry can give a possibility of preventing student burnout, medical student burnout in specific. And I'm really enjoying engaging in kind of this research with Louise and talking to other students. And I've yet to meet any medical student who hasn't come out of these conversations with kind of just this hope that we can make conversations more open and more accessible, because I think that's something that's really missing, at least in my medical school. But it seems like that's kind of echoed across medical schools all the way here to Finland when I talk to my colleagues who are studying medicine in Finland. So I find it really important to be a part of kind of this voice that's starting to emerge, where people are actually talking about the difficulties of medicine, because it's not, I mean, everyone here, I'm sure, can agree that it's not a space where we are not challenged as humans in our work. And I think it's I'm kind of running out of words to say here, to reiterate how important I find it that this change starts to happen from the medical education onwards. And I think that this is a real space for that. Yeah, so that's kind of my lived experience on creative inquiry and how it's kind of changed the direction of my medical education, really. So thank you for making the space for that. And I look forward to hearing your questions later on and chatting. Thank you.
Thanks, Elle. Thank you. Megan, can I bring you in?
Yeah. That okay? Yeah. So yeah, hi everyone. If anyone joined later, I'm an art psychotherapist at Barts Health NHS Trust. And I'm also in the final year of a PhD and have recently run a clinical trial testing the effectiveness of an art therapy intervention to reduce burnout in healthcare professionals. And today I'm going to be talking about the participant experiences of taking part in these group sessions, which I've come through conversation with Louise to kind of understand as flourishing spaces within acute hospital settings. Just very quickly, in case there's anyone who's not familiar with the profession of art therapy, it's a form of psychotherapy that uses creative expression, particularly visual expression, to improve mental and emotional health, and it combines psychological theories and techniques with creative processes. To qualify as an art therapist, one needs to complete postgraduate training, and we register with the Health and Care Professions Council in order to be able to practice, and are recognised as one of the 14 allied health professions and also psychological professionals. I first began using art therapy for clinicians at Barts Hospital when I was approached by a cohort of oncology registrars in 2014. This was a very particular time, kind of socio-political context for junior doctors. The new junior doctor contracts were being, I guess, sort of unsuccessfully negotiated, and it was around the time of the first junior doctor strikes. And this cohort of doctors approached me for support. And I collaborated with them to co-design an art therapy intervention to suit their needs and also to fit their working context. This proved very successful and was something that I repeated with each successive cohort of oncology SBRs as they came through the hospital until 2019. The reason it stopped in 2019 was because of the COVID-19 pandemic. However, this did in fact offer a new opportunity for me to test and develop the methods further with a much broader range of healthcare professionals across all of the hospitals in the Barts Health Trust. And the very enthusiastic and positive responses from participants encouraged me to apply for funding for a grant to run an RCT to test the intervention that we developed. And this quote here sums up why this is important for me. And it links to what Louise was saying. It's not just about the individual. So it's not just about the clinicians. It's also about the patients and the hospital community as a whole. And here you can see that this registrar has explained that when we're given the opportunity to explore the full human experience for ourselves, it's easier to remember the humanity in others. So this was the trial, which has recently been completed. So 129 healthcare professionals who were screened for baseline moderate to severe risk of burnout took part in the study. And what was tested was this brief 6-session program of group art therapy that I developed over the years with clinicians at Barts. And this talk is not particularly about these outcomes, but I think it's important background where the study was positive. So the trial found statistically significant differences between groups for the primary outcome of emotional exhaustion, the key factor for burnout, as well as several secondary outcomes of psychosocial distress. And the positive change was not only sustained, but in fact improved upon at 12-week follow-up. So what was happening? Well, understanding the participants' experiences of the intervention was really important to me. So although I was discouraged by supervisors because I suppose the amount of work involved, it was really important to me to run a qualitative study alongside the RCT. So participant experiences were collected after receiving art therapy, so both the intervention and the control group. It was a waitlist control, so the control group also had the intervention eventually. And a team of 4 qualitative researchers, including myself, used template analysis to identify and analyze patterns in the participant experience data. And what we found were 9 overarching themes. Each theme had its own set of codes. And here you can see are the 4 largest or kind of main themes to come out of this process. And when we start looking at the relationships between the themes and the codes, we start identifying the active ingredients of the intervention. And I think you'll see as I talk about these that they map very closely to these elements of flourishing that Louise has already outlined. So here you can see, for example, the codes that comprise the key theme of relationships. The richest code here is improved relationships and communication with colleagues. You can see there are also improved relationships with patients and connection through shared art-making experience. And something else that emerged that was interesting was a change to the work environment. So this brings us to kind of thinking about it's not just individual change potentially, but there's perhaps some change to a system, a community. And here you can see the role that art making played in supporting connection with colleagues. So here are some quotes from participants. The art making helped in the sense we could relate to each other and support each other. The art provided us a route into opening up with the group about challenges we were facing. Indeed, art-facilitated conversation was the richest code for the role of art-making theme. And here you can see that art also enabled emotional expression and processing. So this links to what Louise was saying about the shadow work. However, on the other side, perhaps, enjoyment and playfulness was a key theme that came through. Art also supported meaning making, freedom, trying new things, and it was a learning experience. Using art materials, a range of art materials, improved participants' mood and sense of well-being. So here you can see the clay session, which was often mentioned in the participant experience feedback, It was great to do something messy and playful. It made me feel more light-hearted, and I felt as though it had a really palpable effect on my well-being. Here you can see that positive changes to mood and sense of well-being was the richest code for the theme changes to self. And if you look closely, you'll see other changes include enlightened perspectives, return to self, sense of solidarity, and feeling less alone. This Euler diagram represents relationships between the role of art making and the other largest themes, changes to self and perceived helpfulness. Art making's role in enabled emotional expression and processing is seen as highly helpful by healthcare professionals. And art making's capacity to facilitate connection with colleagues was perceived as beneficial, along with its facilitation of reflection. So interestingly, with reflection in the feedback, there was reflection, a kind of verbal reflection, but even stronger was the importance to individuals of the role of art to facilitate quiet reflection or introspection. In a relentlessly outcomes-driven context with huge weight of responsibility, giving over to the creative process was a huge relief. And this was encouraged by the playful and experimental use of art materials, which was central to the intervention. So here you can see one junior doctor has described, the artwork guided me rather than me deciding what to do. I enjoyed switching my brain off, allowing to fly freely. And someone else has commented, it's surprisingly therapeutic to do these sessions of introspection and also allowing your brain to just be free and not think too much about rules and deadlines. This theme dyad, kind of looking at the relationship between the theme role of art making and the other theme changes to self, demonstrates how art making influences both individual and social changes. And I think this is really important for understanding the active ingredients of the intervention. So I'd argue, for example, that the group element is essential to the effectiveness of this intervention. It's not about individual mindful coloring to relax, whilst that may have its own benefits. This is about a dynamic process of engaging with colleagues through creative activity and joint attention. And whilst findings such as art therapy's capacity to enable emotional expression and processing to aid personal recovery and growth are already established in the literature, there are several new insights, such as the role of playfulness, creative freedom within a safe, non-judgmental space, being able to play, and how that can facilitate reconnection with the self and with others. And I'll just finish with this quote from a participant, an ICU doctor at Barts. It links back to what both Louise and Elle were saying about well-being and resilience. And here you can see this doctor has said, well-being and resilience are words that get kind of used as a bit of a stick to beat us. It's become this very top-down concept where we're told you have to do this, that, and the other to maintain your own well-being. Art therapy is the reverse. It doesn't feel top-down because you're being allowed to express yourself as an individual. You're given this opportunity to create and to feel a sense of self, which often gets lost in a very big institution like the health service.
Brilliant. Thank you so much, Megan. And so we've got one question in the chat, but I thought we'd start by asking each other questions. Hopefully there might be some more questions coming into the chat, and then we can address those. But Megan, if I can start by just asking you, I have two questions. One was, I loved how you actually explained about this isn't the same as doing mindful colouring alone. There's some magic that happens in the group. I don't know if you could say a little bit more about that. And then the other question was just, what do you hope for the future? You know, how do you hope to see this kind of go for the future?
Well, I think, you know, some of the what we know about burnout, for example, you know, is something that can exacerbate it is feeling kind of isolated, alone. And so we know that connection and belonging, you know, that you kind of have spoken about, are really key in supporting our mental health and our sense of being okay. And connecting to colleagues is very powerful in the workplace. So I feel that in a medical culture, where kind of talking about feelings isn't necessarily historically something that is done or learnt, that having this kind of the creative kind of the art making as a way in to kind of connecting with feelings, to connecting with each other, to conversation, is a really powerful tool to kind of, you know, optimize on the resource that we have in the colleagues we have around us, and in kind of people and in connections within the workplace setting. So for me, it's just really important that the social element of this is not just about sort of individual mental health. This is about kind of systems, connection, community. Yeah, and in terms of what next? Well, I'm hoping that once the trial is published and the evidence is out there, that will kind of support implementation and hopefully kind of evidence-based approaches to staff well-being. And when I return from research to clinical work in January, I'll be beginning to implement groups for BART's clinicians across the trust. So that's where I'll start and hopefully take it from there.
And actually, Megan, someone's just popped a question in the chat that actually overlaps with that question. So I thought maybe just bring that in now. So thoughts on how this can be expanded, e.g. to GP practice, more hospital settings, etc. Could this be co-facilitated or helped set up by a clinician interested in creative health from a hospital or GP practice?
Yes, so this is part of, so it's manualized, and I want to publish the manual. I'm in the process. Yes, and so this is part of, you know, kind of thinking about how can it be rolled out, and I'm hoping to be able to provide training to other healthcare professionals to deliver the intervention in different settings to allow it to grow and to spread in due course.
Yeah, brilliant. Thank you. Did either of you want to ask a question, or shall I go to the ones in the chat?
I actually had one for you, Louise, that I noticed myself thinking of. So I know you've been doing this research for quite a long time now, and I was wondering, what was it kind of in the beginning of it all that made you realize that flourishing is a concept that maybe needs to be brought out more into the kind of healthcare setting as well as medical education? So just kind of curious where that kind of started from, and what kind of pushed you to then kind of start this larger kind of piece of work.
Yeah, you know, like it's hard to look back and see where you came from in a way. What I do know is that I did a talk on resilience and critiquing resilience. And that was probably the starting point. So it was on resilience, and, I had resilience in the title of the talk. And I also wrote a book chapter called Vulnerability, the Arts and Resilience. And again, sort of critiquing resilience. And I guess that was the last time that I used that in the heading. That was, I don't know, 18 or something, or 17. I can't quite remember. I'm not quite sure how and when, and, Flourishing, well, it was after that time, but I can't remember what happened and how that actually became part of the language. But ever since, it was in conjunction with the students. So as I always learn with the students in those creative arts group sessions. And yeah, I can't quite remember, but I know that the concept has been growing because there isn't a huge amount in the certainly not in the medical education literature. There is a bit more in other education literature, but basically, have been growing it over time by exploring it and bouncing those ideas to students and back. But thank you.
Yeah. I think there's another question in relation to your kind of idea of shadow work. And someone's wondering if you could explore how this creative work could lead to confrontation with challenging or repressed emotions, and how in some people there might be some resistance to the shadow work. And then how do we navigate this in a professional setting? Really good question.
Yeah, so so it's not that easy to get medics to start being creative. I don't know if you'd say the same. I guess they approached you, Megan, but when students come in, and what one of my students said, so I start really gently with like bits of doodles, or like drawing a breakfast with your eyes closed, and I try to start really gently with easy things. I do a lot of talk around making it safe. I talk a lot about being process. And for example, we start by choosing postcards because that's quite an easy thing to do, but it does open up a bit more because it brings images together with our thinking and our lived experience. It kind of widens the conversation around what's going on for us. But so for the shadow work, I set a lot of boundaries. So it's not that I'm trying to make people do shadow work, because I think that would be that wouldn't be ethical, but I'm trying to create a really safe space where people can just explore. And when we start exploring our lived experiences, there's shadow everywhere there. But I invite people to choose their own boundaries. So particularly, say with medical students, this is an opportunity for you to explore, but only share what you want to share, or they don't even have to share the postcard. They can share the process of choosing the postcard. So I try to make it as safe as possible so that I don't enter resistance, and try to give people so that they can bring what bit it is they feel safe to bring. So one student said she'd created a little, I don't know, some kind of just put a few materials together, but she said, it's really hard for me to talk about this in a medical school setting, because you can't be creative without putting something of yourself in it, which is both the power of this work and is why I think that it does open, in the way that Megan's been talking as well, the arts open up so much, because we find ourselves being part of those things that we create. But so I think that done badly, this stuff can cause upset and make people angry. And I guess that I think there's I talk about being an artist of the invisible. It's creating a transformative space, and there's an artistry, and you don't get it 100% right all the time, but I'm learning every time I run workshops how to kind of hold spaces, how to read the space, how to help people feel safe in that space. And then often it's breaking into smaller groups. So people choose what they share. But just on that postcard exercise, often people will share stuff that I would say would be shadow work. I don't know, this is some of the challenges or difficulties that you have in your day-to-day working life. But yeah, so I try to avoid pushing anyone to talk about anything deep and meaningful, but just try to hold a safe space. I don't talk about psychological safety and things like that to try to mitigate. I also do a bit of my own vulnerable leadership, so I often share some of my own stuff, that just to show that it's safe, you know, like this is a space where we can talk about this sort of stuff if we want to. Yes, so yeah, and thanks, Alexis, you've posted Marian's question here. This is the harder question, so we're working up to this one.
Louise, just Megan's got a
yes.
hand up as well, so I don't know if
oh yeah, Megan, sorry, you go to Megan and then I'll come to Marian. Yeah.
Oh, it's okay. I mean, it was just really around, I think one of the challenges of this space, at least from my perspective, is this notion perhaps that sort of anything art is sort of fluffy and soft and nice, and yes, it can be, but there is the potential to cause harm, you know, and there is research around art kind of being used by people who kind of open situations up, but don't have the skills to be able to safely manage those, causing harm in participants. So for me as an art therapist, I guess this is something, it's this delicate dance of sort of constantly thinking about the sort of spectrum of practice and what is it that you're trying to do, what are your aims, and what boundaries need to be in place to keep people safe, and what level of kind of qualification and experience does the person facilitating the session need to have. So that was just my thoughts on that.
That's really helpful, Megan. And I've come across that as well, and read stuff around people, yeah, feeling harmed by where it's not been done well. So Marian's question, everyone can pitch in here. So what are anyone's thoughts on how we shift thinking at senior NHS levels that these creative approaches are a way to deliver the many elements of the NHS plan? It's the justification I'm being asked to provide. I have the evidence and experience. It seems to not be accepted as an acceptable use of public money. I mean, just to sort of start open, I mean, my experience has forever been that creativity and bringing the arts into healthcare spaces has been contested. So I've been predominantly working in the medical school setting. It is now, there now is much greater openness, and I'd say it's probably, and it might be Alexis, you come in on the back of this as well, but, you know, I think the NCCH and the launch of the new all-party parliamentary group is around advocacy at all levels within, not just in healthcare, but, you know, that is one area that they're working for. Megan, you've probably had to do some talking and then trying to navigate some of this, have you?
Yes, a lot. I mean, I've worked at Barts for 20 years, so what I've kind of learned is that tenacity eventually pays off, but to a certain degree. But it's ongoing. It's part of the work, and also hence running an RCT and wanting to speak the language of evidence, and realizing that it's important that I have that language if I believe this is something that can benefit. Yeah, not to just moan about it, but to do something about building the evidence.
Yeah, I mean, this might be an area for further discussion at the NCCH level, because I think they're wanting to support those sorts of conversations, and perhaps even bringing together people that are trying to have the same conversations in their different trusts. Alexis, maybe, I mean, I think you're already doing some of that, isn't it?
Yeah, I'm just trying to pin myself so everyone can see me, but I don't think
I can see you. Yeah.
Oh, can you see me? Okay, brilliant. So yeah, this is kind of exactly the work that the National Centre for Creative Health is trying to support, and trying to support that work with healthcare professionals as well. We just saw a report today in The Guardian, actually, and that is actually by their health policy lead, rather than what would normally happen would be by the culture lead. about how creativity can have an effect on well-being, but that is actually by the Guardian's health policy lead. So that is just a showcase of how things are actually changing as well. So as Louise said, we launched the all parliamentary group on creative health, which replaces one on health and well-being. And so we are doing a lot on advocacy at policy level, and we haven't got those conversations at the top policy levels to kind of get it into the systems, because I do know that those who are in healthcare kind of are really passionate about this stuff, want to get it out there, but they want to see it as not an add-on, as a key, you know, work, as Megan's saying. And that will only happen if the systems itself allows it to be. So we can do all this work, but if the system isn't changing itself, so that is our role at NCCH, to help support that. But it's all like little steps, and it completely has changed. You know, we've gone, you know, the arts and health and now creative health movement is very long, but I think you have to see that all the little steps are leading to something, and just keep being as passionate as we can be about it, and we will make change as a movement. Yeah, and you know, that is our work. So if anyone wants any more information about what we're doing at NCCH, please feel free to email us. It's info@ncch.org.uk. But yeah, as I said, that one in the paper today is just great. That is actually by a health policy journalist, which is fantastic.
Thank you, Alexis. And Jane Howard, you've got your hand up. Do you want to unmute and speak, or?
I might have to unmute. Is it Jane Howard?
Yes, or maybe she can't unmute.
I will find it for her. There you go, Jane. You should be able to speak now.
There we go. Yes, sorry, I couldn't unmute before. Yeah, I was just wanting to respond to that, really, and what Alexis has said is absolutely right. But I do feel that things are changing. So I'm the programme manager for the Creative Health Associates programme at the NCCH, which is really, you know, we've got a number of associates working within systems across England. And what has been really apparent over this last year is, you know, there's a much greater willingness to embrace this work. It's landing generally really, really well in systems, in a way which I think 3 to 5 years ago it definitely wasn't. It was definitely more difficult. And just this morning I was talking with colleagues in other organisations sort of supporting this work nationally, and we're all saying we feel there's a bit of a shift. The sort of tectonic plates are shifting a little bit, and we hope over the next year that we will see, you know, some shift. We are there's a lot of work going on at NCCH, but one of the things we're also looking at is looking at the commissioning of this work, and looking at the opportunities within the commissioning cycle to sort of lever in creative health at different points, and also trying to understand a little bit what is it that stops people buying into this. Because I don't think it is that there's a lack of evidence. I think it's that there's a lack of open hearts and minds, maybe, but we're seeing that shift. So I just wanted to give a little bit of positivity there.
Brilliant. Thank you, Jane. That's really helpful. You know, like every little counts. And I think, you know, as we keep plugging away from all our different directions, it feels like, I mean, it is exciting to hear about some people feeling that shift. And I'm feeling the shift, and I'm seeing it across medical schools. People are interested in this work and inviting me to come and share on it in a way that was not happening for the first 18 years of my academic life. So, yeah. Megan. And then maybe we'll bring things to a close. Go on.
So I just wanted to say, you know, one of the interesting aspects of running this trial, you know, in trials, people always are, oh, recruitment's going to be so difficult. So the trial recruited well ahead of schedule. You know, it was we had more participants than were required to power the study. And so people were voting with their feet, you know, healthcare professionals of all levels. So kind of, you know, consultant surgeons, as well as junior doctors, nurses, and so on. So I think, you know, at the kind of grassroots level, there's a huge amount of support for this type of intervention that is seen as more humane, perhaps, and more about kind of flourishing rather than a top-down kind of notion of resilience.
Thank you. That's really heartening. And Amy has just added, is there any way the British Association of Drama Therapists could support you in this? What that would be an example of therapeutic theatre, which is absolutely evidence-based. Yeah, and I think there's a lot of theatre, and particularly in the field of nursing, I think there's a lot of theatre being used and engaged with. And I think actually all the arts therapists, so for the last 20 years, I've been inviting a different arts therapists into the creative arts course. And I've thought forever that they have so much to offer our medical students, and not managed to get anyone frontline into the sort of central curriculum. But I would be very keen to. So I think all of the different arts therapists do have so much to contribute. I don't know, Megan, if you want to say any last word on that.
I mean, I think it comes back to systems and structures and silos of power. So arts therapists in many ways are kind of very well positioned with a sort of foot in creative arts and the foot, they're also healthcare professionals. But in terms of kind of funding for roles and sort of permanent roles that are integrated and part of established pathways, that's another kind of challenge to overcome, I think.
Yeah, that's probably a bigger challenge, isn't it? And in fact, a lot of the work that I've done over the years has been in my own time as well. I think it's, but maybe there will be a time coming as it gets recognised more that there could be funded roles. Thank you, Elle. Thank you, Megan. Thank you, Alexis, for setting this up. And thank you, everyone, for attending. Really appreciated your questions. And we're always keen to hear from people and to keep the conversation going. So thanks very much, everybody.